Welcome to today's lecture on musculoskeletal problem and lameness in horses. These are not just a health issue, they are performance limiting and potential career ending problem. And equine professionals, as equine professionals, your role is to not only identify lameness early but also to understand its causes, manage it effectively, and prevent recurrence. Let's begin by defining lameness. It's an abnormal gait or stance due to functional or structural problems in the musculoskeletal system. One of the most telling signs is head nodding during movement. When a horse nods its head down, it's typically to shift weight of a painful limb. Examination start with history. When did the problem start? Was there a specific incident? Then comes a careful visual inspection followed by gait analysis, both in straight line and on a lunge. Flexion test and nerve block are often needed to localize pain, followed by imaging technique like radiography or ultrasound. Treating lameness is not one size fits all. For example, a hoof abscess may only need drainage and policing, while tendon injuries might require months of controlled rehabilitation and regenerative therapy. Don't forget prevention, good hoof care, proper conditioning, early detection can save a horse career. Let's now discuss a case to apply this knowledge. A 8 years old warm-blooded gelding used for the follow shows jumping. The history: acute onset of right forelimb lameness after competition. No known trauma. Owner report slight heat in the fetlock area. Clinical finding: grade 2 to 5 lameness on trot. Positive response to flexion test on the fetlock. Mild swelling around right front fetlock. No hoof abnormalities. Radiography normal. Ultrasound mild. Superficial digital flexor tendon swelling. Diagnosis: mild tendinitis of the superficial digital flexor tendon. Treatment plan: is to rest for 4 weeks. Hold the therapy for the first 7 days. Controlled walking program after 2 weeks. Recheck ultrasound in 6 weeks. Prognosis good with proper rehabilitation. Which of the following is a common cause of lameness in horse? Laminitis, colic, asthma, Cushing. The correct answer: laminitis. A head nod downward during a trot typically indicate lameness in which limb? Hind limb, episilateral hind limb, contralateral forelimb, episilateral forelimb, opposite hind limb. The answer is episilateral forelimb. Which imaging method is best suited for assessing tendon injuries? Radiography, CT, ultrasound, nuclear scintigraphy. The correct answer is ultrasound. True or false? Trot is the preferred gait to assess subtle lameness. True. Lameness originating from the back ways causes forelimb head nodding. False. Are among the most common reasons for decreased performance in horses. Lameness is clinical science, not a diagnosis. Identifying the cause is crucial. Common cause of lameness: hoof problem, abscess, laminitis, navicular disease, joint issue, osteoarthritis, septic arthritis, soft tissue injuries, tendinitis, desmitis, bone problem, fracture, development, orthopedic disease, back and neck pain, kissing spine, sarcocolitic joint dysfunction. Clinical signs: uneven gait, head nodding, especially in forelimb lameness, shortened stride, swelling and heat in joint or limbs, pain and palpation or flexion test. Lameness examination: history, taking, onset, duration, associated activity, visual exam, conformation, swelling, wound, gait analysis, walk, trot, sometimes canter, straight line and circle, flexion test, diagnostic analgesia, imaging, radiography, ultrasound, MRI, CT scan, nuclear scintigraphy. Treatment strategy: rest and rehabilitation, anti-inflammatory therapy, non-steroidal anti-inflammatory, corticosteroid, corrective showing and trimming, joint therapies, hyaluronic acid, PRP, IRAB, stem cells, surgery for a specific condition, arthroscopy, fracture repair, prevention, regular hoof care, proper training and conditioning, balancing the nutrition for growing horses, regular vet checks and early intervention.